Assalamualaikum and good morning to one and all. Today we'll start with the second part of Pharmacology of Local Anesthetics. I am Sheikh Abu Sufyan. Welcome you to my YouTube channel Pharma Learning Forever. At the end of this e-learning session, you are able to discuss pharmacological action of local anesthetics, why local anesthetics fail to produce adequate anesthesia in inflamed tissue, and we'll also see why vasoconstrictor, that is adrenaline, are used in case of local anesthesia. So let's start with the pharmacological action of the local anesthetics. So first we'll see the local action, because the local anesthetics, they meant for the particular or restricted area of the body, and that restricted area of the body, it is called as the local action. So the action produced at the restricted area, it is called as the local action. So this local action of the anesthetic drug, it is specially due to its action on the nerves. Okay, so we'll see how it produces its action on different types of nerves. So let's start with the first, that are the basic sensory nerve. So the basic sensory nerve, what it does, it blocks the sensory nerve ending. And we know that the nerve ending, these are the millions of points present in our surface of the body, which carries the sensation of especially the hot sensation, cold sensation, or any of the pain sensation towards the brain. Okay, since it blocks sensory nerve ending, the message of this going to the brain is going to be blocked. Okay, and that patient will not feel the sensation of the pain. So it blocks sensory nerve ending. It also blocks the neuromuscular junction. Now what is neuromuscular junction? For example, if this is the muscle and if this is the nerve, then the junction which is in between the nerves and muscle, it is called as neuromuscular junction. So generally these nerves are present on the surface of the skin, or they are present also on the muscles. So forthcoming message which is going from the muscle, suppose if there is pain in the muscle, obviously when you give the incision or during the surgery or the minor procedure, there you are cutting or giving incision to the muscles as well. Okay, so if this neuromuscular junction, it is working properly, then through this NMJ or neuromuscular junction, message will goes to the brain. So what these local anesthetics are doing, they also block the neuromuscular junction, so that message cannot be going, or that message is not going towards the brain. Okay, so this is the action on sensory nerve ending and neuromuscular junction. Let's see what is its action on ganglionic synapse and the receptors. So do remember the ganglionic synapse and the receptors, these are also present in the surface of the body. And the ganglion, it is nothing but the mass of the neuronal cell bodies. So for example, if these are the 3 neurons and these are the cell body of the neuron, so this first portion is called as the cell body. So this entire mass of the cell body of the neuron, it is called as the ganglion. So obviously when the message, it is going from sensory nerve ending towards the brain, it is not going only through the skin. It may go through the brain, through muscles also. It may go through the deep tissues also, where the ganglions are present, isn't it? So if it can block the ganglionic neurons or ganglionic synapse and the receptor, that message will not convey to the brain and the patient will not suffer from the pain. Okay, so the ganglionic synapse and the receptor are blocked, and as a result of that, if you give injection around the mixed nerve. So what is mixed nerve? So there are two types of nerve. One, it is sensory nerves and motor nerve. But when these two nerves come together, right, so that type of nerve, it plays the dual function of both sensory as well as the motor function. So such nerve are, it is called as the mixed nerve. So if you give injection of the local anesthetics around the mixed nerve, then they can causes the anesthesia of the skin, and it also causes the paralysis of the voluntary muscle. Now what could be the reason why it causes the anesthesia of the skin? Because obviously the nerve ending, it is blocked, because you have given injection around the mixed nerve. The motor neurons and the sensory neurons. So sensory neuron, it carries message from sensory organ towards the brain, and motor neuron or the effector neuron, they carries message from brain to the effector organ. So yesterday I have given you example of hot plate. where if you are sleeping, and although you are sleeping, if I have kept your hand on the hot plate, you will be immediately removing your hand. Why you remove it? Because first message goes from sensor through the sensory nerve to the brain, and through motor nerve, now brain it is responding and giving message to you that now you remove the hand, otherwise there will be more pain and more damage. Okay, so these are the natural process kept by Almighty in our body through the sensory and the motor neuron. Now what local anesthetics are doing, and what happen when you give injection around the mixed nerve, they can cause the anesthesia of the skin, because now there is no further carry forward of the message from skin to the brain, right? And it also paralyzes the voluntary muscle, because the movement in the body, it is controlled specially through the motor neuron, isn't it? Now since the injection it is given in the mixed nerve, the motor neuron are also going to be blocked. Okay, so there is blockage of the motor neuron, and due to that, that particular restricted part of the body, there is also the paralysis to the certain extent, and that is what required for the person or for the surgeon to conduct a minor procedure, because the role of local anesthetic, it is only in the minor procedure. You are not using it for conducting the major surgery in the patient. Okay, so this is how you can produce the anesthesia of the skin and the paralysis of the voluntary muscle to produce or to perform the minor surgery. So what you need to do, you need to give the injection of the local anesthetics which in the vicinity of the mixed nerve or around the mixed nerve to produce the anesthesia of the skin and paralysis of the voluntary muscles. Okay, so this is on the ganglionic synapse receptor, then their action in the mixed nerve. Let's see how the action of local anesthetics it is changed with the change in the structure of the fibers and the local anesthesia. Okay, so we know that there are two types of fibers, especially myelinated and non-myelinated fiber. In such cases, the myelinated nerve, they block earlier as compared to non-myelinated nerve. Okay, so blockage of myelinated nerve it's occur earlier as compared to non-myelinated nerve. So if you are performing the minor procedure, so you see that you are giving the injection which is close to the myelinated nerve, so that the blockage can be earlier and you can stop the sensation of the pain. So this is in terms of myelination and non-myelination. Second thing is that in terms of the smaller and larger fiber, the smaller fibers are more sensitive as compared to larger fiber, right? So smaller fibers are more sensitive as compared to the larger fiber. Third thing is that if you compare it in terms of autonomic fibers and somatic fibers, then it is observed that the autonomic fibers are generally more susceptible as compared to the somatic fiber. So what is the difference between autonomic fibers and somatic fibers? Autonomic fibers are those fibers which basically control the autonomic movements of the body, which is involuntary movement, which is not under your control. Whereas somatic fiber, it controls the voluntary movement. For example, the movement of the hand, it is controlled by the somatic fibers, right? So in case of these two types of fiber, when you apply the local anesthesia, so it is observed that there is first effect on the autonomic fibers, and then there is effect on the somatic fiber. So this is the action of the local anesthetic on the basis of their structure. So myelinated nerve block earlier than non-myelinated nerve. Small fibers are more sensitive than larger one, and autonomic fibers are generally more susceptible as compared to. Okay, there was some connection issue in between, and I have reconnected once again. So now we'll see what is the action of local anesthetics when local anesthetics are applied on the tongue. Okay, so we'll see the action of the local anesthetic when it is applied on the tongue. We know that the tongue, it is meant for the taste, and it is responsible for sensation of the different types of taste. Okay, so the taste, it is one of the sensation. Like pain is the sensation, so likewise the taste, it is one of the sensation which is carries towards the brain through your tongue. Okay, so when you apply local anesthetic on the tongue, it will produce effect on the different type of taste. So you can see here the bitter taste, it lost first, and it is followed by this loss of the sweet, then loss of the sore, and the salty taste. So this will be the sequence of loss of the taste if you apply local anesthetic, especially on the tongue. So the bitter taste loss first, followed by the sweet, sour, and the salty taste. So likewise, it also having the effect on the location of the fiber, because some fibers are present which is on the proximal part, and some fiber which are present on the visceral part of the body. So based on location of the fiber, the local anesthetics, the action it is different. So proximal area supplied by the nerves are affected earlier, isn't it? So what is proximal area? So the proximal area, it is present which is on the surface or towards the surface. So if that area it is there, then it is affected first as compared to the visceral area. So proximal area supplied by the nerve are affected earlier. Then fiber present circumferentially. So circumferentially means, suppose these are the nerve fibers, or this is the part of your body, and those which are fibers which are present in very deep part, it is called as the circumferential fibers. Okay, so those fibers which are present circumferentially, so in such cases they block earlier than sensory fibers which are present in the core of the nerve. So that is the difference of the action of the local anesthetic based on the location of the fiber. So proximal area supplied by the nerve are affected earlier, then fiber present circumferentially, they block earlier, then sensory fibers in the core of the nerve. So I am sorry, here inadvertently I have shown it in opposite way. So do remember that circumferential fiber which are present in the surface of the nerve, whereas the core fibers they are present inside. Okay, so please get it corrected. So the core fiber they are present in the core of the nerve, which is in deepest part of the nerve, whereas circumferential fibers, these are present on the surface portion of the nerve. Okay, so those fibers, the core fibers are blocked later on. So the first there is blockage of the circumferential fibers. So this is the action of the local anesthetic based on the location of the fiber. Let's see now the second part of today's outcome, or the topic learning outcome, that is why local anesthetics fail to produce adequate anesthesia in the inflamed tissue. Okay, so we'll see what is exactly happening in inflamed tissue, and due to that the local anesthetics, their action it is decreased, or they doesn't produces the action as expected. Okay, so the first reason is that when the patient suffer from inflammation, in case of inflammation, it lower the pH of the tissue. So wherever there is inflammation, at that part it lower the pH. So the low pH means what? There is acidic pH, and we have seen in yesterday lecture that the local anesthetics, they are basic in nature. So when acid and base they come into contact with each other, do remember that there is formation of the salt and water, and this process it is called as ionization. So this is happen through the process of the ionization. Okay, so the local anesthetics, since in case of inflamed tissue it lower the pH become acidic. The local anesthetic having the weakly basic pH, they undergo process of the ionization, and this is universal phenomena in case of the drug, that ionized form of the drugs it is not absorbed, right? So greater fraction of local anesthetics due to low pH, it is remains in ionized form, and it is not absorbed at the muscle area where you need local anesthesia. So suppose if you have applied it on the surface, it has to cross the membrane in order to absorb into the muscles, isn't it? It won't absorb. Why? Because it is ionized over there, because the inflamed area, the low pH, it react with the base, and that drug it is converted into ionized form, and due to its ionized form, it will not cross at the in the deepest part of the tissue where you expecting the local anesthetic action. So that is one reason inflammation, it lower the pH of the tissue, it convert or greater fraction of the local anesthetic present in ionized form, and it reduces their action. Second reason is that the blood flow to the inflamed area it is increased, and it is very logical, because if you see the color of the inflamed area, that inflamed area it is always red in color. Why it is red in color? Because there is vasodilation, and due to vasodilation there is more amount of the blood it is flow at the inflamed area. Now, where you want action of the local anesthetics, if you see the definition, for in case of local anesthetic, you want local action. Okay, so you want local action, it means you want to restrict the blood supply, because if there is more blood supply, in case of inflamed area that we have seen, there is increase in a blood supply, then what will happen, the drug will be washed out, the local anesthetic will be removed more rapidly from the site, and it will goes into the blood circulation. Why? Because in inflamed area there is more increase in a blood supply, and due to increase in a blood supply, the local anesthetic, they will be removed from the site where it is administered, right? And you want action of the local anesthetic at site where it is administered, at the restricted part of the body. Now what is going to happen due to inflammation, since it's come into contact with the lots of blood, the drug will absorb into systemic circulation. Now it will reduces the local anesthesia, and it is going to produce more systemic action, that is you are not expecting in case of local anesthesia. Okay, so this is second reason, the blood flow to the inflamed area, it is increased, and local anesthetics, they are removed more rapidly from the site, right? Third reason, it is effectiveness of adrenaline injection, which is generally given to produce vasoconstriction so that blood supply can be restricted. So this effectiveness of adrenaline injection with local anesthetics, it is reduced at the inflamed site. So whenever you are using the local anesthetic, first you give the injection of the adrenaline so that there is vasoconstriction, and you will get more blood free area, because you are giving the incision, and when you are giving the incision, if there is loss of the blood, it will be the problem. So adrenaline, it is the drug on the blood vessel, it produces vasoconstriction, and due to vasoconstriction, it reduces the blood supply. So it help you in providing dual action, that is it provides vasoconstriction and restrict the blood supply, and secondly it also provide you the blood free area to perform the surgery. Okay, but when you are giving adrenaline in case of inflamed tissue, as there is inflammation produces vasodilation, so it opposes the action of the adrenaline, or it reduces the action of the adrenaline at the site of injection. Fourth thing is that all inflammatory products, inflammatory mediator, they also opposes the action of the local anesthetics. So overall, we have seen the four reasons by which the action of local anesthesia or action of the local anesthetics, it is decreased in case of the inflammation. So start from the pH, increase in the blood supply, reduce the action of the adrenaline, and fourth one, it is inflammatory mediators, which opposes the action of the local anesthesia or local anesthetics. Okay, so this is about inflamed tissue. Now let's see what is the role of vasoconstrictor, or why vasoconstrictor like adrenaline, they are used in case of the local anesthesia. So the first reason is that, or the advantage of the vasoconstrictor in case of the local anesthetic, is that it prolong duration of action of the local anesthetics. Now why it going to prolong? Because the adrenaline, it is a vasoconstrictor, it will limit blood supply, and due to limit in blood supply, there is no washout, or there is no removal of the drug from the site of action. So the drug remains more at the site where it is applied. Okay, it is not absorbed into systemic circulation, and it help you to prolong the duration of action of the local anesthetics. So although you applied less drug, but it remains there and it is going to produce their action. So this is the first advantage of using vasoconstrictor. Second advantage is that it enhances the intensity of the nerve block. Since it helps you to enhance the intensity of the nerve block, it produces synergistic action with the local anesthetics, because local anesthetics, in order to produce local anesthesia, the important action, it is the blockage of different types of nerve. We have seen just now. Okay, so those nerves, their intensity of the nerve block, it is increased if you are using vasoconstrictor. Okay, so it helps you to speed up the action of the local anesthetics. Third thing is that it reduces systemic toxicity of the local anesthetics, because due to less blood supply, due to vasoconstriction, drug will not absorb into systemic circulations, and as a result, it is not exposed to different organs and system. So you can avoid side effects of the drug because of absorption into systemic circulation. So overall, it reduces systemic toxicity of the local anesthetics. It provides more bloodless field of the surgery, because there is vasoconstriction, and due to, suppose if this is normal blood vessels and these are the constricted blood vessels, so obviously in the normal blood vessel there will be more blood supply, there is more blood flow, and if you give incision over here, then there will be more loss of the blood. But if blood vessels are constricted, then entry of the blood to the area where incision it is given is going to restrict, and it is going to provide you more bloodless field, which is ideal for doing any minor procedure. Okay, so these are the advantage of use of vasoconstrictor. But although it is the advantage, every drug having two side of the coin, both advantage and disadvantage. So likewise, the adrenaline or vasoconstrictor, their use in local anesthesia also having certain disadvantages. So what are those disadvantages? So first disadvantage is that it make injection more painful, right? Because it produces a shrinkage of the skin. The blood supply is less. There is vasoconstriction, right? So at the area where you are giving injection, till the time you are not given local anesthesia, there your nerve are more sensitive. So when you are giving injection, the injection become more painful. Whereas I agree that after giving injection, since these are the local anesthetics drug, it is start reducing the pain, or it is start lead to loss of pain sensation. Okay, but when you give the injection of the local anesthetic at the site, there will be more pain if adrenaline is being given. Okay, so appropriate dose of adrenaline can be given to avoid more painful injection of the local anesthetic. Second thing is that it delay wound healing. Obviously, the wound healing, it is happen through different healing mediators which are present in the blood. Since there is vasoconstriction, so there is less blood supply, and due to less blood supply, these healing mediators, or the mediators which are responsible for healing and repair, are not reaching at the site of the incision, at the site of the injury, right? So it is going to delay the wound healing. Third thing is that it rise in a blood pressure, because adrenaline, it is sympathetic drug. What it does, it increases the heart rate and force of contraction, and due to increase in the heart rate, it rises in blood pressure. In some patient, even it promote the arrhythmia. So these are the disadvantages. So based on the patient, based on the type of the surgery, and based on the nature of the patient, you can decide what dose of the adrenaline is to be given, or whether adrenaline is to be given or not. So that can be decided based on the history of the patient. So these are both advantage and disadvantage of using vasoconstrictor or adrenaline in case of the local anesthesia. So I have done with my first part of today's session. So before going ahead with the second part, let's have the few questions, and I request you to give answer in the comment box. So my first question is, recommend site of injection for anesthesia of the skin and paralysis of voluntary muscle. So we have seen that if we want anesthesia of the skin, then at particular site we need to give the injection of the local anesthetics. Okay, so I'm expecting you to post the answer at what site we need to give the injection of the local anesthetics, so that it produces especially the anesthesia of the skin and paralysis of the muscle, which is required for performing the minor surgery. So let's see who give the first answer. Okay, I can see Sadia has mentioned about ganglionic synapse and receptor, but very appropriate answer it is given by Anjali. It is the mixed nerve. Okay, so Jihan has also mentioned, Vedant, or Nazira, Ashraf. Okay, very good. So when we are giving the injections in the mixed nerve, it basically produces anesthesia of the skin and paralysis of the your muscles. Okay, so mixed nerve, that is both the nerve which having the nature of both motor as well as the sensory function. So if such nerve, if you are given the injection, it produces, since it is motor, it avoids the movement, so produces the paralysis of the muscle, and since it is sensory, it also avoids sensation of the pain. So very good. I can see many students are answering, but still I have not seen answer from every student. Now I can see more than 85 students, they are online, they are watching the session, but everyone has not given the answer. Okay, let's move on to the next question. Among myelinated and non-myelinated fibers, which one block first by local anesthesia? So we have seen this is the effect on the different structure of the local anesthesia. there are myelinated nerves and non-myelinated nerve. So among these, which nerves they are affected first, means they produces blockage of which nerve first as amongst the myelinated and non-myelinated. Very good. I can see the first, the answer it is given by Sufreen Banu, then Mithili Sai has given the answer, Vedant has given the answer, Jihan has mentioned, Aftab has mentioned. These are the myelinated nerve, okay? Very nice. So the myelinated nerve they block first as compared to non-myelinated nerve. So this is the action of local anesthetic, especially based on the structure, okay? So many students are answering Naved, Saddam, Amina, Roma, Saima, Nazir. Okay, very good. So you have to be very prompt, because once answer has been known to everyone, the copy pasting that and putting in comment box, it is not a difficult task. So those who give the answer in first 10 seconds it is the true answer. Okay. So you have to be very prompt in giving the answer. Let's move on to the third question. What is the effect of increase in a blood flow due to inflammation on the action of the local anesthetics? So here we have seen the four type of effects. Okay, so let's summarize it. I want every one of you to give different reason. What is the effect of inflammation on the action of the local anesthetics? Okay, so Mithili has mentioned first, the drug remove fast. Okay, the drug removing fast because due to there is more blood supply. Okay. Kais has mentioned that vasodilation. Okay. What is apart from this? Apart from drug removal, what are its different action? Okay, I can see that everyone is mentioning about drug it is removed. Yes, Sabira has mentioned about effectiveness of adrenaline it is reduced. So this is second reason. Very nice. Nazira has mentioned that that is it opposes the action of the local anesthetics, and that is due to the inflammatory mediators. The first reason I have not yet seen, which is something related to pH, and what happened due to pH. Yes, Sahir has mentioned it lower the pH. Very good. And Muskan has completed the answer due to low pH, since it is weakly basic in nature. So acid and base come in the contact, it produces the ionization. Okay. So all four reasons now they have come up, and we have seen that this lower pH lead to ionization. Then second thing is that we have seen vasodilation, it supply more blood. And third thing we have seen it is something that is it opposes the action of the adrenaline, and the inflammatory mediator it directly also opposes the action of the local anesthetics. Very good. So we have seen pharmacological action of local anesthetics, and that we have seen about a local action. Okay. But what if these local anesthetics if they are absorbed into systemic circulation, right? So we'll try to cover the systemic action and some part of the pharmacokinetics of local anesthetic also in today's session. So do remember that if local anesthetics, if they are highly lipidic in nature, we have seen in yesterday lecture, especially the aromatic group, it provide it increases the lipophilicity of the drug. So if such lipid soluble drugs are there, then they can easily crosses all the membrane and goes into the blood circulation. The moment it goes into blood circulation, the drug is going to expose to different vital organs. It is going to expose to the blood vessels, and whatever it produces, these are all side effects, or it may be the adverse effect of the local anesthetics. Obviously, because you don't want drug it is absorbed into systemic circulation, because you are expecting the action on the restricted area of the body where it is applied. You are expecting its local action. You are not expecting systemic action. So if by any means and ways, if drug goes into systemic circulation, it is going to produce side effects. So now we'll be talking about their systemic action. So depend upon the concentration of drug which is absorbed, or which is goes into systemic circulation, it produces different action. For example, in case of central nervous system, if brain it is exposed, so obviously if drug it is lipid soluble and goes into the blood, it will also reach to the CNS, because CNS that is the blood brain barrier, it is also lipidic. So all lipid soluble drug can reach the CNS, or most of the lipid soluble drug can reach the CNS and has the ability to influence the action of the central nervous system. So the local anesthetics, the overall action on the CNS is, it is not just stimulation and depression, but it produces mixed action. So initially it produces the stimulation, and stimulation it is followed by depression. So it is, and it's depend upon the concentration. Suppose if concentration is less, then it will only produces the stimulation, it may not produce the depression. But if as you increase the concentration, or if the more concentration of the drug, if it is absorbed into systemic circulation, then the local anesthetic may produce stimulation at initial part, and which is followed by the depression. So overall action of high dose of local anesthetic in systemic circulation, it looks something like this. Initially it produces the euphoria, that is feeling of great happiness. Then there is excitement, mental confusions, twitching of muscles, and convulsion. Okay, so up to these symptoms are the symptom of the stimulation, okay, till convulsion. Okay, after convulsion, now there is no more stimulation of the brain, the patient will suffer from unconsciousness. And we know that the unconsciousness, it is one of the highest grade of CNS inhibition. The sedation, hypnosis, then general anesthesia, that is unconsciousness, and last stage it is the death of the patient. Okay, so the unconsciousness it may happen, also it may lead to respiratory depression, and obviously if there is very high dose of local anesthetic it is given, then the CNS depression, it is to the extent where that patient may die. Okay, so the death may also occur. So the death in a dose dependent manner, it may be also possible with the local anesthetics. So as a surgeon or anesthetician, if you are doing minor procedure, so you see that the drug it is not absorbed into systemic circulation, and that is the reason we have seen we use the adrenaline, so that there is vasoconstriction and the less blood can absorb into systemic circulation. So this is the effect on the CNS. Second, the effect on the CVS, that is cardiovascular system. So the effect on the cardiovascular system, it is the depression. It produces the cardiac depression, so there is depression of the cardiovascular system. In addition to that, the no effect are observed at conventional dose. So all those side effects, obviously it is going to be seen in case of high dose of local anesthetics. So that is sometime required in case of the patient, and in those cases it may produce effect on some vital organ. So no effect are observed at conventional dose, obviously it produces the cardiac depressant action at the high dose. Then some of the local anesthetics which having the structure like the quinidine, so they have quinidine like anti-arrhythmic action. Okay, so we know that the quinidine, it is anti-arrhythmic drugs, it reduces arrhythmia. Okay, and it is generally used in case of very high heart rate or the heartbeat, that is called the tachycardia and arrhythmia. So the quinidine, it is one of the good anti-arrhythmic drug, and some of these drug by the virtue of its cardiac depressant action, because it produces cardiac depressant action. So some of those drug which produces quinidine type anti-arrhythmic action. So what are those drugs? So like amide derivative of procaine. So when we have seen that two types of local anesthetic. One is ester, another it is amide. So if intermediate chain, if it is amide, and if you are using amide derivative of procaine, then this amide derivative of procaine, it is called as procainamide, because it is the amide derivative, it is not an ester derivative. Okay, so when you make amide derivative of procaine, it becomes a procainamide, and procainamide, it is one of the classical anti-arrhythmic drug. So that is another action, and this action, it is due to its virtue of cardiac depressant effect on the cardiovascular system. But all local anesthetics are not used as antiarrhythmics. Only procainamide, which is amide derivative of the procaine, can be used as a classical antiarrhythmic drug. So this is the action on the cardiovascular system. Let's see what is the action on the blood vessels. So obviously when drugs goes into the blood circulation, it is also going to come in contact with the blood vessel. So on the blood vessel, it produces a sympathetic blockage, and due to the sympathetic blockage, the blood it produces the dilatation and fall in the blood pressure. So this is the effect when drug it is going into systemic circulation only. Okay, so produces sympathetic blockage and it produces fall in the blood pressure, and then a high concentration of the local anesthetics, it may produces the direct relaxation of arterial smooth muscles, and you can see the overall effect due to sympathetic blockage, also dilatation and fall in the blood pressure, and due to relaxation of the blood vessels it increases their diameter, and overall result will be the dilatation of the blood vessel if the drugs it is coming in contact with the blood vessels, right? So this is the effect on the blood vessel. Now let's see what happen in case of toxic concentration of the local anesthetic. For example, in some patient, if local anesthesia is not induced and if anesthetician having keep on giving the more dose of the drug, then sometime it may reach to the toxic level. So toxic concentration of the local anesthetics, it produces the cardiovascular collapse. How? Because we have seen on the blood vessel it produces the dilatation, so it is going to reduce the blood pressure, and in the cardiac it produces the cardiac depressant action. So there will be, due to the cardiac depressant action and there is due to the dilatation of the blood vessel, there will be severe fall in the BP, that is the blood pressure, and if blood pressure it is fall to at below normal range, then it may lead to the cardiovascular collapse and the death which is happened, that is either due to the very severe CNS depression and due to cardiovascular collapse, or it is the result of both the action on the CNS and action on the cardiovascular system. Okay, so that is the reason you need to precisely control the level of the local anesthetics which is given to the patient. Now let's see about the pharmacokinetics of the local anesthetics. What is its effect on ADME profile, that is absorption, distribution, metabolism and excretion. So obviously when we are giving the local anesthetics, we are sometimes applied on the skin or we are giving the local injection. So suppose if we are applying on the skin, then see what is its effect. So absorption from the intact skin, it is very poor. Why? Because that is what you expect. You don't want the drug it is absorbed into systemic circulation. So generally the absorption from intact skin it is poor, and that is the ideal or one of the good property of the local anesthetics. Now if you increase the aromatic ring or aromaticity or lipophilicity through the aromatic group, then this may be the different, and it may not give the poor absorption, rather it may lead to the more absorption from intact skin, and the drug may goes into the blood circulation and produces a side effect. So good local anesthetics, it must have the poor absorption from the intact skin. Okay. In case of soluble surface anesthetics like lidocans and tetracan, so we have seen in case of surface anesthetic there are two categories, soluble and insoluble drug. So the soluble surface anesthetics, in such cases they can rapidly absorb from the mucous membrane and the abraded area. So generally when you are performing the minor procedure, what you are doing, you shave that particular area. Suppose on the scalp you want to give the stitches, then you shave, you remove the hair, and when you remove the hair, when you apply the razor or the blade in that particular area, so the superficial layer of the skin it is removed, and that area it is called as the abraded area, right? Now since the superficial rim has been removed, and also what is the property of this anesthetic, they are soluble in nature, so these are the soluble surface anesthetics. So these drugs can rapidly absorb from the mucous membrane and also from the abraded area, and it might produce the side effects, systemic side effects also. So this is in terms of the absorption. Let's see about the metabolism, how the local anesthetics undergo the process of metabolism. So lipophilic local anesthetics, which having the more aromatic group, are widely distributed, and you don't want more distribution of the local anesthetic. So do remember that. So you must have the less lipid solubility in local anesthetics. So lipophilic drugs are widely distributed, whereas ester-linked local anesthetics, these are very interesting, and we have seen in yesterday lecture why we are preferring amide local anesthetic over the ester, because ester local anesthetic like procaine, it rapidly hydrolyzed by plasma pseudocholine esterase and the remaining esterase enzyme in the liver. So in the plasma the enzyme present it is the pseudocholine esterase, and the enzyme present in the liver it is esterase. So it quickly undergo process of metabolism once it enter into systemic circulation. Okay, so ester-linked local anesthetics undergo quick process of metabolism in the plasma through pseudocholinesterase and in the liver through the enzyme esterase. Okay, so this is about interesting part of the metabolism about the esterase. Let's see about the amide link local anesthetics, how they are undergoing the process of metabolism. So amide local anesthetic like lidocaine, they are degraded especially in the liver microsome by dealkylation and hydrolysis. So the metabolism of amide link local anesthetic, it is occurred by the process of dealkylation and hydrolysis. So those who are preparing for GPAT point of exam, this is very important point about the metabolism of ester, pseudoesterase in the plasma and esterase in the liver. Amide link local anesthetics, they are metabolized by the liver microsomes by the process of dealkylation and hydrolysis. Okay, after oral ingestion of these drugs like procaine and the lidocaine, they have very fast first pass metabolism in the liver. Now this is the reason because why you are not administering local anesthetic through oral route. So first reason, obviously you don't want its systemic action, and second reason is that when you give through oral route, there is very fast first pass metabolism in the liver. It means in the liver local anesthetics are quickly undergoing the process of metabolism. So as they are undergoing process of metabolism, their systemic concentration is going to decrease. So after oral injection, both procaine and lidocaine have high first pass metabolism in the liver, and they are not active orally for anti-arrhythmic purpose. So we have seen the procaine, their amide derivative procainamide, it is used. Why? Because they are not active. The procaine itself, it is not active, and you are using the procainamide so that it cannot be undergo metabolism by the enzyme pseudoesterase and the esterase in the liver. Okay, so that is the reason why procaine as such, it is not active orally for anti-arrhythmic purpose. Otherwise you would have used the procaine itself, you have not converted it into procainamide, right? So this is about the metabolism of local anesthetics. Let's move on to the distribution of the local anesthetics. So all local anesthetics, it can cross the blood-brain barrier because they are lipid soluble in nature, and it may influence the action of the central nervous system, and just now we have seen their action. Then it can cross the placenta, so it is the matter of concern when local anesthetics are given to the pregnant woman, because it may enter the bloodstream of the developing fetus, and it may going to produce effect on the fetus who is growing under the mother womb. Next and last portion, it is of the excretion of the local anesthetics. So obviously if it is enter into systemic circulation, then this drug they are excreted majorly through the kidney. So the major excretory organ, it is the kidney for both local anesthetic, that is amide as well as ester local anesthetic, right? But in case of ester, it appear in very small concentration in the urine, whereas because they almost completely hydrolyzed in the plasma, because we have seen the ester local anesthetic, they undergo the process of hydrolysis by the pseudocholinesterase enzyme, and when it goes into the liver, it is metabolized by the esterase enzyme. So as such, as the complete undegraded drug, or in their original form, ester, it is rarely seen in the urine because it is present in very small concentration due to its degradation or due to its hydrolysis in the plasma. Whereas the procaine, it appear in the urine as 90% of para-aminobenzoic acid and 2% as unchanged form. So this is in case of the procaine. It is present as a 90% of PABA, which is one of the metabolite of the procaine, and 2% in the unchanged form. In case of dialysis, suppose the patient is suffering from the kidney failure, and such patient, if you are given the local anesthetic, then you have to think about that. So the patient undergoing the dialysis, such patient unable to excrete unchanged portion of the ester or the amide. Okay, so since they are unable to excrete unchanged portion of the ester or the amide, the action of local anesthetics will increase, and it may lead to increase in toxicity of the local anesthetics. So you have to take the special care when patient suffering from kidney failure and he is on dialysis. Obviously the patient who is suffering from kidney failure is on dialysis, right? So till the time you conduct the dialysis, that drug is remains into blood circulation due to less urinary output, or their metabolites are remains in the blood circulation, and it may contribute to increase in toxicity of the local anesthetics. Okay, so these are the special precaution you need to take care in case of the kidney failure patient. So I have done with my today's session. I have referred KD Tripathi, Essential of Medical Pharmacology 6th edition. I must thanks to the author of these textbooks for providing wonderful information on this chapter. So thanks for watching my session. For more such learning, subscribe to my channel. And if you like this session, then do remember to give me a thumbs up. So I am releasing the second quiz and attendance link in the chat box. Okay, so quiz and attendance link has been released in the chat box. It is going to remain active for next 5 to 10 minutes. So you are requested to attend the quiz and give the attendance.